Hi, and good afternoon, everyone. Thanks for joining us. And this is our virtual Texas and COVID-19 Forum on Philanthropy. I am Laura Dixon with Spur Sports and Entertainment, and this year I serve as the president of the Texas Lyceum. It is 4:01 Central Standard Time on Thursday, April 9th, and this forum is our third. It's for Texas Lyceum directors and alumni and friends. And we've organized these talks for Texas leaders to talk with Texas leaders in a candid way. So it's great to see so many tuned in today. We have 1 hour for the conversation. Please send your questions to Amanda through email or use the Q&A feature at the bottom of your Zoom screen, and we'll get those answered. Amanda is a class of 2016, and we will have this recording available on texaslyceum.org. We'll also send it out via email after we wrap things up. Amanda, thank you for leading the conversation today. I'm going to turn it over to you now.
Great. Thank you, Laura. And hello, Lyceum Nation. Thanks for joining the webinar today. Laura, thanks for inviting me to moderate. Not only because this forced me to put on makeup for the first time in about a month of working from home, but also because philanthropy is my profession and a passion, but I think, as most of our panelists will agree, it's also a calling. And it's a real privilege to do the work that we do and be able to help our communities through our jobs. So today we're going to talk about how this pandemic has impacted the way we go about doing our business in philanthropy, how we support nonprofits, and how we continue to help people in our communities. Really, it's been the local foundations on the ground who have been really instrumental in responding to this challenge. But it's philanthropy and some of the folks on the call today who fund those activities and enable those nonprofits to be those first responders and on the ground. So thank you to our panelists today. And joining us, we have Eric Pearson from the El Paso Community Foundation. We have Wynn Rosser from the TLL Temple Foundation. We have Margaret Cox, who Margaret advises families, individuals, and family foundations about a myriad of things, but philanthropy is one of those. So thank you guys for joining. I think today we want you to walk away from this webinar feeling smarter about 3 things. So how is philanthropy responding to this pandemic in Texas? How might this impact the nonprofit business practices going forward? And then also maybe some valuable lessons from these folks who are making big decisions every day about how they're making those decisions in a time of uncertainty. And hopefully you can take that back to the organizations that you're working with and that you represent, and this will be useful and valuable to you guys. So I think before we jump into the panel questions, I just want to provide some context around the philanthropic response to COVID-19 so far. So globally, there's been $5.1 billion raised to address COVID-19 issues. That's been contributed from 400 funders, really, again, around the globe. For context, and to put that in perspective, so that's about 5 times more than was raised for Hurricane Harvey, the Ebola response, and the Australian wildfires combined. In addition, there have been 386 funds established across the US to address COVID-19 issues in different communities. 8 of those are here in Texas. And so another thing to mention is that nonprofits were also included in the recently passed COVID-19 stimulus package. But I think the question is, in the midst of this sort of rapidly changing environment, where virus testing and treatment is changing, where the needs on the ground are changing and community response is changing rapidly. Is all of that going to be enough, or are nonprofits going to have to change the way they do business, and therefore philanthropy going to have to think about the way they fund those nonprofits? So we've got a lot to talk about, a lot to unpack today. So I'm going to go ahead and I think get started with Wynn. And when the Temple Foundation does amazing work in poverty alleviation and advancing opportunity in rural communities. And so I'm wondering if you could talk a little bit about what you guys do, but also sort of what your short-term response has been to COVID-19 in East Texas and the communities where you operate, and then how this is impacting your long-term plan.
Appreciate the opportunity to be here today and connect virtually with an organization that means a lot to me, and with leaders who are very active and engaged in their communities. And if anything is going to change in our communities, it's going to be because people like us mobilize, work alongside each other, and bring about change. So I'm appreciative of the opportunity to talk about some of what we're doing here in rural East Texas. The TLL Temple Foundation is headquartered in Lufkin, which is about an hour and a half north of Houston and about 2.5, 3 hours east of Dallas. We're in the piney woods of East Texas. The Temple family was a timber family and started a small family business that became a Fortune 500 company. And although the business operations have now all been sold, the family's philanthropic legacy is still focused on and concentrated on the rural counties where they operated businesses, where the family lived. And so essentially we go from Texarkana all the way down to the Gulf of Mexico, along the eastern corridor of the state, right along the Louisiana border. We focus on rural counties where the food insecurity 3 weeks ago was already higher than the state and national averages for children and adults living in food insecure households. We focus in a region of the state with more uninsured kids, in a state that has the most uninsured kids in the country, and in a state where the poverty rates are higher than the state and national averages. So our priorities 3 weeks ago are largely the priorities today. We're still focused on food insecurity. We're focused on increasing access to healthcare in our rural communities. So we have 23 rural counties, 1 in Arkansas and 22 in Texas. 8 of those counties have 0 pediatricians. 11 have 0 OBGYNs. 11 have 0 dentists. And so when you think about the network of organizations we have here to respond to a health pandemic, our health system is more fragile and less robust than it is in larger urban areas. But right now, the impact we're feeling the most in our rural counties is the economic impact. We have a lot of hourly workers, a lot of especially low income and African American and Hispanic adults that work more than one job, paycheck to paycheck, trying to make ends meet. They're the folks I'm most worried about right now. And to that end, just in the last week, the foundation hosted 2 emergency food box deliveries here in Lufkin, 5 hours total over 2 days, where we distributed 2,200 boxes of food, 18,000 pounds of chicken, about 50,000 individual meals altogether. People were lined up for miles. You know, you've seen the Texas Tribune did a great article, I guess, yesterday on food distribution in Austin and the challenges in Austin. Well, imagine challenges in communities that have far fewer resources than Austin. We didn't have an HEB truck backed up to the food delivery location where we were doing this. So, you know, the challenges are always real in rural communities. We have fewer resources, but we have tremendous spirit. Last week when we hosted that food distribution, we had more than 20 volunteers from 5 or 6 organizations, including churches and community groups. And so when you put out a call, again, leaders show up. And so over the long term, you know, our priorities will be the same. Over the short term, the way we're working right now is primarily through existing grantees with whom we've had good relationships, long relationships, who we know are well positioned to their communities to make a difference because they've been doing that work for years and decades. And primarily right now focused on basic needs, immediate needs like food, health, and mental health. We know at some point we'll transition to an economic recovery, and we're thinking about workforce, labor market issues as well.
So you all are unlikely right now to, in this kind of crisis mode, to work with nonprofits that you hadn't worked with previously, but maybe in the long-term view, you would consider some new grantees.
So just earlier today on a call with one of our senior program officers, we talked about a new organization in food distribution, an organization that we wish we'd have known about 3 years ago because they're doing great work. And so they came to us as a recommendation through one of our partner organizations, and the likelihood within next 2 or 3, well, today's Friday or Thursday, by Monday or Tuesday, it's likely we'll be making a grant to them. And so we've speeded up our grant process like many others. We've gone to very simple grant agreements or no grant agreements, a shortened application, no reporting requirements, or very few reporting requirements depending on the size of the grant, but trying to make sure that our processes match the urgency of the situation.
So you guys have already changed the way you're doing things. That's great to hear. Thank you for all that amazing work you're doing. I think, Eric, maybe we could shift to you. I think having the community perspective that you might offer as a community foundation representative could be really helpful. But also, and I believe you guys were one of those 8 funds that was established in Texas to address COVID-19, but I think you also have a few other initiatives. I noticed today one of those was called Get Shift Done. So that's a very creative name. So maybe you can talk about some of those initiatives, but then also on kind of a broader level, thinking about how funders can collaborate and the impact they can have by working together, and then some of the sort of novel approaches or models to also working with local government and nonprofits on the ground that are addressing this disaster.
Sure. So, we share some of the same demographic issues that Wynn does. The 3rd poorest zip code in the United States exists in El Paso, Texas. And so we're always dealing with people who are right on the edge of homelessness and extreme poverty. And of course, we have a large undocumented population that lives here and works here and is in some cases doing essential jobs. And so we're trying to fill in those cracks, really. And I don't know if all the rest of you funders share this, but I feel like everything that we're doing is just a tiny drop in the bucket, but we have to do what we can and get those that bucket full of lots of tiny drops. So the collaboration piece is really big with us. So we're working with a lot of emergency grants. We've raised somewhere about near about $500,000 in COVID response. We've activated about $175,000 to buy personal protection equipment for not hospitals necessarily, but for those hospital workers or the healthcare workers who are, dealing with patients in a very personal way, but not necessarily in a hospital setting. Centro San Vicente, it's a clinic, a free clinic, the Baptist clinic downtown. So a lot of those very, very tight-knit community centers where people are going for primary care. Additionally, we're equipping the El Paso Police Department and El Paso Fire Department with personal protection equipment too, because of course they were not prepared for this in this situation to this magnitude, and so they're stuck. Another of the funds we're trying to help nonprofits that have had to cancel events and have lost revenue and have really been on the edge and hand to mouth for the last 3 weeks trying to figure out if they're going to survive. So we've made some emergency grants to them. And I'm proud to say that, when we started working and moving everybody to home and started working remotely, our staff, got right up. We had a Zoom meeting. We talked about who's in need. We put together a list of the folks that are in need, and we sent donors that way. As we stood up our fund, we knew that it was important to not have our hand out in an emergency. And then the third thing that we're doing, you mentioned, is Get Shifts Done. We've only had one news anchor screw it up. The name was not my idea. It actually originated at Communities Foundation of Texas in North Texas. So Communities Foundation of Texas and an app called ShiftSmart connected shifts at the local food bank at North Texas Food Bank to restaurant workers. And right now I'm looking at the data for El Paso. Displaced workers, those that have applied for unemployment benefits, by and large in the last 2 weeks, 1/3 of them are restaurant or food preparation. And so we know that that's a big population. These are hourly folks. They're earning very little per hour and they're working on tips and things like that. So we wanted to figure out a way to connect them to essential volunteer jobs at the food bank. And we've made a whole bunch of grants to food bank and pantries to get food out to folks. But our active role is to get those workers who are not earning anything right now in front of the food prep at the food bank, pay them $10 an hour as 1099 employees, and we're trying to limit their shifts. There's a threshold where it's going to affect their unemployment applications, but we're really trying to give them a sense of belonging in the community. The first thing to go were these restaurant workers. They're really a vulnerable group, but they're able to sort of have the dignity of work and have a reason to get up in the morning and go and do something and make a little money and, put some groceries on their own table. So that Get Shift Done has been pretty outstanding. We launched it last Saturday and we're doing about 50 shifts a day at the local food bank and hope to expand that. But, we're not engaging our capital yet. The Community Foundation is not. We're really kind of passing money through the foundation to support the community because we know we're in it for the long haul. We've stood up Get Shift Done for about 8 weeks as far as we can tell, and that's where we think we're going to start see this wane. But we've got to be there for the nonprofits and for the businesses that are really, really struggling. And I apologize if there's wind noise on my microphone. I had to step out because I have 4 sons, teenage boys inside the house, and this is the quietest spot I could find.
That's fine. I'm curious, are you seeing, so at least in Houston, our community foundation here around Hurricane Harvey mobilized several disaster relief funds for different businesses that were set up so that the businesses could provide funding to their employees who were really impacted by Harvey. It looks like the Greater Houston Community Foundation might be doing that again. I'm wondering, have you guys had that interest from corporations in El Paso? You think that's something that you all would do?
It's a tricky business for a community foundation to do that kind of thing. And Steve Maislin is a lawyer. He is the CEO at Greater Houston, and he probably gets it a little better than I. I'm a little more conservative on our approach. So we're really working with that nonprofit community. But that nonprofit community is also an employer and represents a large part of the community. So we want to be able to support those folks they don't have the same kind of revenue stream. And the biggest part of it is, I'm talking to our board members who are applying for SBA loans and those kind of things. And we know that those have been activated very quickly. And so that's not necessarily the lane we want to be in right now. We're collaborating with other funders, United Way, the Health Foundation here, and really trying to make sure that we are working from what we know well. And I'll tell you, unfortunately, this is our 5th emergency response at the El Paso Community Foundation. We have, Mexican earthquakes, and we helped with Hurricane Harvey with Greater Houston. We had that shooting last year in El Paso, and so we have become very much an emergency responder. We've been dragged kicking and screaming into it, but we know it's important work. But we know it's also not. It's a small portion of what we're going to have to do, especially in this situation. As I heard, $5.2 million raised worldwide. A lot of that is coming from corporations, and people who are not sure what's going to happen with them are less likely to give on an individual basis. So it's going to be harder for us to raise that money, and we're going to have to deal with it in a different way moving forward.
Yeah, and I think this disaster and the other disasters you mentioned, the impacted parties were a defined group. So, right, the disaster hits, the hurricane hits, who's been impacted and who hasn't, and who's going to be able to help those who have been impacted. In this case, it feels like everyone is being touched by this in some form or fashion, and it's such a huge, economic crisis.
And there's another part to that, if you don't mind my interrupting. It's not over. So, you know, we had the shooting, it was over, everybody's able to come together. We had the hurricane, it was over, everybody's able to come together. This one is continuing. And so people they're ruled by fear, and they are trying to figure out how to make their next step happen. And so I think it's the uncertainty is what really keeps people on edge and is going to change the way we operate throughout. And I don't even know how to prepare for the next one like this, but that fear, I think, has prevented our community from coming together in the same way that it does when something happens, and then you can just move on from it or try to heal from it.
Yeah, that's a good point. Well, thank you. I mean, it seems like you all are doing some really, really great things, and that you mobilized quickly and moved fast, and that we're going to get a tour of the landscaping.
Just move into the shade.
So I want to pivot to Margaret. Margaret, I think you bring a really interesting perspective for the folks listening in. I'd be interested, how have the families and the family foundations and the individuals that you work with, what have they been talking to you about in terms of kind of early response to this? How are they feeling about contributing to nonprofits and about their philanthropy? Are there any, it's a long question, but are there any sort of emerging trends or recurring themes that you're hearing from these folks? And then I think my final part of this, which probably everyone can also take a stab at, is I know you serve on some nonprofit boards. So is anything that you're hearing, any of this sort of anecdotal information that you're hearing from the folks that you work closely with, informing the way you think nonprofits should be approaching funders going forward, you know, in this current environment and going forward?
Okay, so we've timed this perfectly. So I'm sitting in Washington County right now, and we have a major storm rolling in literally as you've been giving me my intro. So apologies for the lightning and what's going to be a lot of wind and thunder, I think, while I'm speaking. So I work with multi-generational family enterprises, helping them develop their strategies for how to transition from one generation to the next. As part of that, a big chunk of my work is helping families with their family foundations, their philanthropic activities. And so we have definitely been in communication a lot in the last 2 to 3 weeks about how they want to reach out and respond to COVID-19. Some general patterns, and I think a lot of them that I'm hearing from my clients are what you've heard from Wynn and Eric. They're kind of taking a phased approach to this. I'd say most clients are family foundations right now. They have already, or if they haven't, they are about to help out, do emergency funding for basic human needs, reaching out to funding for hospitals and food banks and the like. So that's just right out of the gate, no questions asked. That's what we're going to do. Then the kind of the second phase that I think they're beginning to move into is how do we help our existing grantees, those who really, are on the brink? How do we help stabilize them, get them through this crisis? I think we've mentioned it earlier. I'm going to have to go turn the lights on. Hang on one second. Okay. So they're trying to stabilize those grantees that really are on the brink themselves. And then there's this the desire to wait and see, right? So everyone I've talked to expressed that very natural human tension that they're all experiencing within their foundations between wanting to act, just just being overwhelmed by the need that's out there, but also knowing that they need to take the long view, they need to stay within mission, and also need to wait and see what's the gap going to be between public and private funding. A lot of them are really interested, the stimulus packages and the SBA loans and all, they want to wait and see where the gap is and how they might go in and fill it. Another theme I would say is, and Eric talked about this, we're all experiencing this crisis. It is a crisis unlike any other, in that there is no one untouched by it. Certainly people are experiencing it at varying levels of impact, but I would say bear in mind that these family foundations are also going through it. For families that still own and operate companies, they may well have to put their philanthropy to the side right now as they try to focus on keeping their businesses going and their employees in payroll going.
Uh-oh, Margaret. I think the storm might have finally impacted your Wi-Fi. So I think maybe if I could, I've got some questions coming in from the hotline, but I think maybe Wynn and/or Eric, does either one of you want to take a stab at how nonprofits should think about approaching funders in this environment right now and going forward?
Well, there's a saying that if you know one foundation, you know one foundation. And so we're all going to have our own approaches. We each have our own personalities, our own assets and strengths, our own strategies. And so you'll see different foundations behave in very different ways. And it would be easy to judge or question why a group is doing one thing or another. But our trustees convened for a special called video conference last week to discuss how we will respond. And one of the things I shared with them is we will be in a situation where we must choose right versus right. We could, there's private foundations are required to disperse 5% of essentially of our endowment, our invested assets every year. There's a call for foundations to overspend. The Temple Foundation has a history of doing that. But we could spend 10% and not have enough, or 15 or 20, or we could push all of what used to be $500 million. I'm not sure what it is today, but everything that we have out the door, and there would still be tremendous need, and we would still have to make hard choices to do so. And so regardless of which particular way you pursue your funding and your funding strategy, and whether you're thinking about basic human needs or ensuring the nonprofit community remains stable and viable, those are both worthy and right paths to pursue. But at some point, we have to make choices. So our choice at this point, our priority is on nonprofits that are executing their mission, that are responding. Now, some are responding in different ways, but we have been approached by organizations before the Paycheck Protection Program was announced to help them make payroll because they're a fee-for-service organization and they were unable to serve clients and thus get income. And we had not yet acted on those requests. Now we're referring organizations to the PPP or the CARES Act funding. And we've put our priority on those that are serving basic needs, again, health, housing, mental health, and food. So, I think the nonprofits themselves, there's a great piece that was put out by Sea Change Capital Partners. It's called Tough Times, Call for Tough Action. I think we'll share it as a follow-up, but it has a framework for the nonprofits themselves to think through what's their mission, can they execute their mission at this time, are they responders, hibernators? In other words, do they withdraw and ensure that the organization is able to return when the situation normalizes, or are they a hybrid? Are they able to operate in some ways perhaps not the full way that they were prior to the pandemic. But it is the most sobering 5 pages I've read in the last 3 weeks about the nonprofit sector and the very hard decisions nonprofit executives and boards will have to make. But it stresses that the board's duty and the ED's duty is to the organization first. That's a hard thing to hear in organizations that exist. As you said, it's a social calling to help people. But it really, I think, gets to the point Eric and Margaret were making, which is about this is going to be a 12 to 18 month thing at a minimum. And what do we do to ensure that the nonprofit organizations that play such critical roles in our communities are there and able to respond when they're called upon? They may not be able to do so now, but they may have to make hard decisions, and philanthropy won't be able to sustain them all through this period.
Yeah, you very well could be investing in organizations today that might not be here 6 months from now. So that's got to be hard as you kind of navigate those decisions too. I think, Eric, did you have any thoughts there?
Just a small part of that. You know, I sit with a bunch of community foundation executives from around the Southwest, and everybody in that, you know, world is suffering pretty hard, and we don't have the same spending policy guidelines that private foundations do. You know, so we have a range in our spending policy, but of course everybody has upped it. We upped ours from 5 to 6% this year to deal with this. But we're also down 12% as of March 31st on the stock market. The Community Foundation for Arizona has, you know, it's $1 billion foundation, so it's an economy of scale, but they're down $200 million. And so, you know, they're thinking about that. The other part of it is, as an active community foundation, we had plenty to do. You know, most of our grant making was spoken for. So in an effort to be nimble, we're trying to skim a little bit of that frosting off the cake by extending our spending policy, and then hoping that the economy can deal with what it has to deal with. And I like the choice between, you know, making a choice between the right thing and the right thing. I've felt throughout this that we're sort of, if we're working on the best practices for people to get through this virus, then we're screwing the economy. And if we're working on trying to deal with the economy, you know, we have two diametrically opposed missions in some ways that are trying to ask for money, and trying to weigh that has been very, very difficult. What we're finding is we're seeing a lot of nonprofits that provide like services coming together to try to deal with childcare and those things. And those are the things that we like. We like to see people cooperating in a time of need. And we definitely like to see people who are coming up with original ideas. Mm-hmm. I think that helps us make a lot of decisions, because it proves that there's a community spirit there, and not just the I'm suffering just like everybody else kind of thing, but I'm suffering more, which we get from a lot of nonprofits all the time.
Yeah. Yeah, and I think sometimes philanthropy doesn't always get credited with being able to act with nimbleness and with urgency. And I feel like everything that you guys have both outlined, you are acting with urgency, but you're acting with urgency responsibly and around the parameters that you've already set for your work. So thank you for everything you're doing. Okay, I'm gonna ask these questions before people stop sending them to me because I'm not addressing them. Okay, so one is, as a nonprofit executive operating a collective impact project, I'm curious if the foundation representatives on the call foresee a time when some smaller nonprofits will need to shut their doors or make the decision to reluctantly roll up under larger organizations with similar mission and populations. Are you, and how are you preparing for those difficult discussions with their stakeholders and communities?
I'll take that if you want, Wynn.
Sure.
So we deal with that anyway. Prior to this, you see a lot of folks who are duplicating services. And so our foundation, you know, we break nonprofits in our community into sectors. So there are the animal, you know, people, the fine arts organizations and arts and culture. We're dealing with LGBTQ+, and all of these organizations that have some duplicate services. So we've been trying to get them together and come up with priorities that they can work on in a marginally collective impact model. We're also part of a larger, and I know Wynn is as well, part of a larger collective impact project on education. And so all of those questions are omnipresent. Whether or not this accelerates it remains to be seen. But I think it's not a bad thing necessarily to get people who are like-minded to just think alike and work together. And so I think there are going to be some of those hard decisions made, and maybe this accelerates that process. But at the end of the day, it's very interesting to deal with that kind of dynamic, because just like I said before, everybody's suffering, but we're suffering more. That's some of the attitude around nonprofits. Oh, I'm doing cat rescue, but our cat rescue is a little bit different than, we do calicos, and so we want to get those folks together and see the bigger picture. And sometimes when you're working so hard on your mission and you're passionate about it, you don't always see that. So I think our role in the community is to really step back, rise up above all the fray and give people that 20,000 foot view and say, this is how we could really do better work. And it doesn't require anybody to go away. It just requires you to work together.
Yeah, that's a really good point. I mean, this is going to force consolidation in many industries, right? You think about the energy industry and things that are going to happen in that industry as they've been devastated, and many industries have. And so it makes sense that the nonprofit industry, right, the nonprofit sector would go through some period of consolidation too. But I think having a trusted entity like you all helping to encourage that collaboration and consolidation can only help it happen in a happier, maybe healthier way. So great answer. Okay, sorry, Wynn, did you have a thought on that? So another one is, are funders providing loans to current nonprofit grantees? Anyone funding or leveraging their leadership for universal testing in their community? So I think two-part question.
We aren't making loans at this point. Everything that we're doing is through our typical grant-making strategy, only speeded up, and again, with the process matching the urgency. One of the limitations we have is rural headquartered foundation serving a rural community is we have few philanthropic partners. And so some of the really cool, neat, elegant things that are being done in New York City or in Dallas or Houston, it's hard to do here when you're by yourself without a community foundation here. There's a community foundation in Tyler that does a nice job, but they're not here in our 22 counties. We don't really have the same corporate sector that the larger communities have. And so you think, well, who do you partner with to put some of those really elegant financial vehicles together? And Eric's point earlier, they're complicated, and there are legal issues involved. I know George Tang, Lyceum alumnus works at the Communities Foundation of Texas. I follow his work. I'm aware of some of the things they're doing. Eric mentioned that connection earlier as well. And then you think, well, how do you pull something like that off in a rural community? And so at this point, we are only making grants, but if someone is aware of a rural-oriented foundation in another part of the country that's figured out a way to run a loan program by themselves, I'm wide open to ideas. I, again, love the approach, love the strategy, but it's just not the way we've chosen to pursue our work right now.
So we have a history of making loans to nonprofits, especially those that have an endowment, an agency endowment with us. So, for example, the Symphony is in a loan program right now, and we're paying them 5% from their endowment. That helps, they're giving up that distribution every year from that endowment fund within the community foundation, and that helps pay off the loan. And hopefully it's paying at a better rate than we're giving them. And a lot of times we'll forgive a lot of that. The other thing that we're doing is we've actually set up a community development financial institution as a supporting organization of the El Paso Community Foundation. And we're just getting underway with that, but my board has capitalized it with $5 million that we can put into a loan fund. And for example, this week we're considering a request from the local food bank to acquire 2 refrigerated trucks. And so we may be loaning them about $300-something thousand at 2%. But our goal in all of that is to be in that space for nonprofits who may not qualify or may not be open to a regular bank loan. We're just kind of in that middle ground. and to make sure that what we're doing is community oriented and creates that rising tide. And then the other part of it is, you know, a lot of banks, especially those that don't have a community storefront, you know, they have CRA, Community Reinvestment Act requirements, and we can be, you know, a minority funder and bring in some of those banks to really carry the heavy load and also help us with that. So we're working on having a pretty robust loan program, and honestly, we're struggling to get it going for this first loan right now with the food bank.
Yeah, I mean, that's great that that's going to be the first one that you're focused on, right? So much need, clearly. The other thing I think that you should mention that you're doing, right, is for those nonprofits that can't get maybe a regular way loan because they're new or they're startups, you're helping them build that history, that loan history, so that maybe they will be able to go to a bank and get that loan once they're able to show kind of their experience with you guys. So that's another great way to support them. I think okay. So here's a question that I'd thought of. So we've kind of addressed this, but right. So this is changing quickly. Everything's evolving, and so the idea you have today might not be the best approach tomorrow. So how are you all making decisions and moving forward? And how are you, Eric, in your case, well, both of you, how are you enabling your board to make those decisions and not just freeze from the uncertainty and the probably the issues they're facing in their own kind of portfolios and lives and with their own businesses? How are you helping them, and how are you helping your staff not just be frozen with uncertainty and to keep making decisions through this crisis?
So I think one of the roles of the CEO is to set the tone. And so, you know, I'm trying to remain calm, and I'm trying to focus on the things I can control. I can control my attitude. I can control the way I respond to others, and we can do our jobs. It's true that although I'm in my office today, because I live 15 miles out of town, and I would be having the same problems Margaret had. So I failed to mention the role rural broadband plays, and so that's a whole other soapbox I can get on. But you know, that it's a real issue, and it's an equity issue. It's an urban and rural equity issue, the digital divide, which is only, I think, probably wider than we thought it was. But I'm at my office today, but most of our staff is working from home, like I guess just about everybody else now. We can still do our jobs. We just interact by video as opposed to walking around the corner and asking a question. So we can focus on doing our work. We can focus on making connections with the people in the communities that we rely on. We rely on community leaders as experts upon their communities. Our education team is talking to educators, college and K-12. Our health and human services team is talking to federal qualified health clinics, rural health clinics, the nonprofit hospitals, the food banks, the food pantries. And so we're either making small group calls or individual calls. We can do our jobs. We can look for needs. We can make connections. We can influence. And so I think part of this is just reinforcing that we still have work to do and focus on what you can control. With the board itself, I already had delegated authority for grant making. For this period of time, the trustees have increased my delegated authority with reporting to them on a as needed basis based on dollar thresholds. So I will run that, and they can change it anytime they want to. But right now we're working that way through August the 1st with the enhanced levels of flexibility for the staff to make decisions reporting to the trustees. We have a trustees meeting in April, and we'll have a routine grant agenda with several $1 million worth of proposals, several $1 million, which would go out pretty soon after this meeting. And so, you know, one of the things we'll have to work through is which of those do we think are essential right now, because they were a good idea 2 months ago when we were working them, and they're a really good idea today, and which ones can be deferred. So, you know, we will have to make some hard decisions that way too. But again, it's through the lens of what we know about the communities we serve, and staying true to our founder's intent, Mrs. Munn's, which was T.L.L. Temple's daughter, which was to help the working people of East Texas.
Mm-hmm.
So, she speaks to me every day about that intent.
Well,
Figuratively, not literally now.
yeah. It also seems like you're really staying in tune, and your staff is really staying in tune with the community, and therefore kind of keeping all of your work kind of top of mind, and letting that kind of guide what you're doing, and not just being crippled by uncertainty. So that's really, you're setting a really good tone. I think we've had a few others. So a question for you all: there's a lot of heroes that have emerged in this pandemic. Folks working at HEB, for folks working in food delivery and front lines and healthcare. So in particular, thinking about grocery and grocery response, HEB is one of the Lyceum sponsors, and I'm curious, I don't know what they've been doing in y'all's communities, but from a corporate response standpoint and a corporate social responsibility standpoint, what has impressed you about their response, and are there other kind of examples like that, or advice that you would share with corporate leaders about how they can take care of their communities during this time?
I have to interject and say the best thing that HEB could do for El Paso is open up a store here.
Oh, yes. Okay. That was a good response. What about advice to corporate leaders that you might give them, and how they can take care of their communities? I'm sure you have a lot of corporate leaders on your board.
Yeah, so I think the issue really is not being tone deaf within the community. I think our foundation really prides itself on having an ear to the ground and trying to respond in like manner to what needs to happen. And to the early question, I think it goes hand in hand with having a board that is representative of the entire community, not just business leaders, because I think that provides a really good opportunity to have diverse points of view. And so someone who might be providing some really good corporate leadership and have the resources to put into it may not have the perspective of a teacher or a nurse who's dealing with this as well. So I think that's a big part of it. But our experience has been with another grocery store chain, HEB, that happens to be in El Paso. You missed out. That has been very responsive. They have immediately started a keypad campaign throughout the community and throughout the Southwest for their individual communities, and they've already made 3 grants to us. They have a COVID response. They've helped us with some basic needs, and they've given through us to the Get Shift Gun Program. So they're really moving quickly. And I think that's the best thing that you can see, is that folks are listening very carefully to the community. And not to toot our horn, but I feel like we're a trusted, sort of resource that they can go to and say what's going on, whether it's at a corporate level or at the local level. I think that if they can be honest with themselves and provide an honest response, I think it's very, very helpful. Even if it's not a lot of money, it may be just an innovative program or something that they're doing for their own employees if they're big employers in the region. This particular thing affects employees everywhere. And so I think that's a big part of it.
Yeah, absolutely. Thank you, Eric. Wynn, do you have any thoughts?
I think Eric did a nice job. We have fewer national brands or even state brands in rural communities. Lufkin does have a small HEB. We have the Brookshire Brothers grocery store chain that's headquartered here in Lufkin. So here the business owners are a part of the community. And so I think the connection to community is real. The business owners raise their family here, their grandkids are here. And so there's not really the big separation that you might see in a larger community. But I think the big thing I would say is let's do our best to keep people employed. I think the government has offered some really impressive vehicles to do so, whether it be the state government and the way you can maintain employment and also draw unemployment benefits, the Paycheck Protection Plan and others. the greatest social corporate responsibility at this point might be to keep people employed and figure out a way to do that to the extent possible.
Yeah, speaking from the perspective of I work on both corporate philanthropy and family philanthropy at the Friedkin Group, and we're a partner of Toyota. And I think what we've really looked at is, first and foremost, how can we keep our people our priority and ensure that we keep as many of them employed as possible? But then maybe what are some other assets that we can leverage supporting Toyota's distribution of medical supplies and manufacturing of medical supplies? How can we leverage our corporate assets to make an impact in the community? I mean, similar to what you guys really, Eric, are doing, is leveraging your assets and expertise of fundraising and fund building and having that fund available for people to support. So that's one way we're doing it. But I do think many corporations right now are struggling with keeping their employees paid and employed throughout this crisis, and not knowing when things are going to wrap up is a challenge. I think one question, we've got a few minutes left, but one question that I definitely want to ask you all is, how can philanthropy use influence and advocacy to support COVID-19 response or support others doing this work? I mean, I think obviously being included in the COVID stimulus package was a great thing. Nonprofits are going to need much more support and will want to be included in further packages. So how can you guys use your influence to support those efforts and other philanthropists out there?
So I think one of the best things we can do is communicate to the community, in a way that doesn't look like we have any stake in it. I mentioned earlier, I always feel bad after, there's an emergency, here we are with our hands out, but we're also trying to, provide a helping hand to a lot of folks. And I think that people see us in that light. And, our audience may be limited, but it may be an audience that cares. These are donors to the community foundation. These are people who have shown an interest in the community at large. And so ideally, if we can get good information out to them, something that's not, Fox News versus CNN, whatever it is, the opinion piece that you're reading, something that's, straightforward, fact-based, and calm in tone, I think we're doing right by, adding that to our group. And those folks have a sphere of influence, and those folks have a sphere of influence. And the idea is that if we're communicating well to the community and without becoming white noise and saying this and this every single day, 5 emails a day, we can do a good job of leveraging community spirit around what should happen. And this is our view of what should happen, of course, but the idea is that we have some credibility within our view. And hopefully that's something we can do to help.
So from an advocacy standpoint, in the near term, we've had conversations with some of the national membership organizations that have government relations teams. The National Rural Health Association, for example, there was a significant funding in the CARES Act for rural hospitals. We're still working to understand exactly how that funding is going to be used and how it benefits our rural communities. But there were successes in this third stimulus package. And so I think if there is going to be a future stimulus, how do we continue to advocate for nonprofits as small businesses, as was mentioned earlier, and as employers that add value beyond just the services, but the wages that are returned back into the community through the workers and what they spend locally. The longer term, things like rural broadband, expansion of Medicaid, funding for rural hospitals. So there are long-term implications of policy decisions that were made legislative sessions ago that are coming to bear now. So Texas has had more rural hospital closures than any state in the country, 23 in the last 10 years. If the health impact hits rural communities in the same way it has the more urban communities, that fragile healthcare delivery system will be exposed. And again, policy decisions have led to the financial situation that our rural hospitals are in. So we're thinking longer term as well as how does this current reality inform the way that we should approach advocacy going forward, again, on issues that have been important issues to us for a long time, whether it be rural broadband, health, access to health, expansion of available benefit programs.
I mean, that's a really smart approach, is utilizing this disaster to help push some of those things forward and finally kind of shine a light. Like I think you said, there's such a divide between urban and rural, and finally shine a light on some of those issues and push some positive change forward. Margaret, welcome back. Just in time for some closing thoughts.
Yeah, speaking of the limitations rural broadband, experiencing it in real time. My apologies.
No problem.
Cogent closing. Oh, okay. So, yeah. So we're having the experiencing the limitations of rural broadband as we speak here. So I'm so sorry about that. What I would say from the perspective of family foundations is to certainly keep in mind that they are also experiencing in real time this crisis, trying to make sense and meaning out of the world, just like the rest of us. In some cases, as I think I was saying before I lost connection earlier, they are quite concerned about on their funding abilities going forward, are planning on giving more than, sick lines. But they're in the business of philanthropy because they care greatly. And we've had a lot of practice in Texas and of course all over the country, but with disasters, and these foundations are ready to move into action, not just now in the short term, but they're in it for the long term. They are balancing the need to, as one of the directors said to me, how much dry powder do we hold back right now? And so, trying to wait and get good data, trying to see where that gap is between public and private funding so they can go in and fill in there. And then seeing what happens, as I said, with their own portfolios. When I asked them, do you foresee this changing your strategy or affecting your areas of giving? They said, no, we really don't. It's how we go about administering grants, that may change. Our reporting requirements, and I think Wynn's already spoken to that. There's a lot of implications to be seen, but they're in this business to help their communities. And I think the final thing I'd say is, I asked them, what advice would you have for potential funders right now? And they said, now is not the time to try to cultivate new relationships. This is the time to really reap what you have sown, and the investments you've made in these trust-based relationships up until now. And communicate, be open, be transparent, be honest about the viability of your organization going forward, be prepared to reassess your business model and to talk about that. But they want to hear from their current funders, and at some point they will be ready to open their doors to potential or grantees rather. They'll be in a position down the road, though, it's not yet to consider new grantees.
Well, thank you. Thank you for those closing remarks and for weathering the storm and jumping back in. We really appreciate it. I don't know, we're a little over. Wynn, Eric, you guys have done an amazing job. I don't know if there was anything you wanted to conclude with, but if not, we will we'll kind of close this out. I want to thank you guys for everything you're doing to stabilize and help these nonprofits sustain their work, especially those that are fighting the pandemic right now, but also your long-term trusted partners, because they're going to need your help down the road. And Margaret, thank you for everything that you're doing, and really appreciate all the information that you provided. And I think this, for those of us who are navigating this pandemic from our home offices, right, and some people feeling isolated, I think this dialogue and this discussion was really helpful, because I feel like even though we're on our own, we are still tackling this challenge together as Texans and as Americans. And so thank you for all the work that you guys are doing. I really appreciate it, and that will conclude our panel. Thanks, guys. Stay safe.